Welcome back to Island Life Live. If you have painful hips or knees or know someone who does, you'll want to pay close attention, pay close attention to our next guest. He is Dr. Paul Norio Morton. Am I saying Norio?
Yeah, that's
I can roll it. I can roll that R.
Norio. Go for it.
Morton, yes, and he is from the Hawaii Sports and Spine Institute. Aloha, Dr. Morton.
Nice to meet you.
Thank you for being with us. And you know, I know you're kind of like a local celebrity. You're a local boy, right? Tell us a little bit about your background and what you specialize in.
Okay, so I was born on Oahu, but I grew up on the Big Island. I went to Keao High School, and I left and went to college in Ohio, did fire and rescue for a couple of years, and then came back home, went to John A. Burns School of Medicine, eventually went off to the mainland, did my residency training and fellowship, and came back. And now I've been practicing in just hip and knee replacements and, you know, all things knees, both operative and non-operative treatments. So
I love that.
That's what we get excited about.
Would that be considered orthopedics?
Orthopedic surgery.
Orthopedics.
That's my specialty.
Wow. So going from fire and rescue to orthopedics. How did you make that jump? I mean, like, what was it in your mind that you thought was important?
Well, so, you know, when I was in the fire department in Ohio, I really, you know, I enjoyed actually taking people out of the car. Right, after car accidents, you know, the jaws of life was an exciting tool. You get to help open up the car, get people out,
get them to
safety, and then I wanted to see the next step. So I always thought I was going to be a trauma surgeon, and then I noticed that all the trauma doctors, you know, the ones that operated the most were orthopedic surgeons, and ultimately after the traumas and all of these complicated, after getting everybody fixed, a lot of times they develop arthritis down the road. And so what I really wanted to do was kind of take care of people who have had, you know, broken hips, broken knees, and kind of struggled for a few years in trying to get better and start walking again. And I can see the outcomes from that type of surgery, and I got really excited about helping people.
I love that, and I love the fact that you love to help people, because that's what it comes down to, right? Hips and knees help us get around. This is our motion, right?
100%.
Our motion joints. So you know, and I often hear you being referred to as a robot doc. What is that all about?
So I'm really excited about technology, right? And so in hip and knee replacements, we've kind of been doing knee replacements the same way since the 70s, except for the last few years, we've really developed robotics. And so when I did my fellowship at University of Chicago, my fellowship was really in taking a look at how do we do robotics. And so when I came back, I was the first guy who had done a fellowship doing robotics in hip and knee replacements. And so I started my practice here, and I really brought forth robotics and popularized it in Hawaii. And robotics allows us to really enable us to get our alignment appropriate. It also allows us to balance the soft tissues using the robot. And I believe that helps my patients recover faster. It lets me use smaller incisions. And overall, I think better outcomes with my patients.
I love that, and I'm not trying to get, you know, being a little too forward, but can I touch your knee? Let's see what that's all about. So, I want to touch his knee. It's bionic.
So I brought a model because I just wanted to talk about what a knee replacement is, because a lot of times when people think about knee replacements, they think we're just taking our knee and cutting them in half,
and then just sticking it together,
and sticking metal and plastic in. But really, what a knee replacement is we're shaving off the ends of the bone, right? And all we're doing is capping it with metal, kind of how the dentist caps teeth. And when the dentist caps teeth, that takes away the pain. We do that on both sides, and then in between we place a plastic bushing, and that plastic bushing is what allows for the motion. And so it's really more of a resurfacing operation as opposed to just cut and chop and trying to, you know, this big operation is a little bit more elegant.
And your robotic technology helps us to do it in a better way.
So basically it allows me to get my alignment so I get straight knees. It also allows me to take advantage of the soft tissue balance so I can try to get my, personalize the way that I'm placing my implants to match the patient's anatomy instead of just doing the same operation for everybody. It's tailored to every person that comes to get an operation.
I love that. This is awesome, Doc. Thank you so much for this. And you know, I think our viewers would be very interested in talking story with you, and just seeing what it is that you've been able to bring home to us, all of your schooling away, bringing it back home to Hawaii. Thank you so much, Robot Doc. Mahalo to Dr. Paul Morton, our Robot Doc. We're gonna be back right after this break. Let me see. Just kind of